Hello students, my name is Bobby Carlton and I would like to speak to you today on becoming an RN and let you know the benefits and the challenges as well as the requirements for this fascinating field. Today I would like to inform you of the skills and requirements in becoming an RN, to inform you how an RN can serve in a platform in demonstrating some attributes that God values in the Word of God. I would like you to close your eyes for a minute and imagine yourself lying sick in a hospital bed, no strength to walk or help yourself. Imagine yourself in severe pain trying to get attention, your nurse's attention, as well as pushing the call button, but to no avail. 30 minutes later, your nurse finally comes around and gives you pain meds. I would like to say that I have worked in the medical field over 20 years as a phlebotomist and at various hospitals and have went to patients' rooms and have seen the impact that nursing shortages can have on patients as well as staff. So the purpose of my speech today is to educate you regarding the description of an RN, the benefits, challenges, and the education requirements to become an RN. I'd like to validate this career field today by giving 4 main points. First one being the job description of an RN. Recording patient medical history and symptoms, helping perform diagnostic tests, analyzing results, administering medications, treatment, patient follow-up, and rehab for the patient. And this is according to Donald Albin in his book, Created for Connection. A second point would be, as an RN, you may also educate patients and their families how to manage their illnesses, their injuries, explaining post-treatment on discharge from the hospital, home care needs, diet, and exercise. This is also found in Donald Albin's book, Created for Connection. And another job description may be starting IV fluids, administering blood products when a patient will need blood transfusion, also consulting with the doctors and other healthcare clinicians. Another job description would be documenting on charts or in the computer system these days, treatment that's been given, consulting with the doctors regarding patients' complaints that they may have. And then last thing I'd like to give this job responsibility to be providing supervision to other licensed practical nurses, as well as to nurses' aides, patient care assistants, and RN can also go higher into supervisory positions as well. My second point would be presenting challenges as an RN. Jobs can be demanding and require a lot of time, a lot of long work days. May require you to work overtime. And that's according to Mary Muscarl in an article she wrote called Learning Express. And as well, the salaries, you may reach the salary ceiling or your top pay very shortly after you start, within a few years. It starts off high, but plateaus usually 5 to 10 years in some cases, according to Ms. Muscarl. Personality conflicts, at times you may have to deal with doctors that come across as arrogant and rude. This is according to an article, allnurses.com on computer. Also, you may be exposed to dangerous or hazardous situations. At times you may have to wear protective clothing, goggles, gloves, maybe dealing with infectious diseases. So those are some of the challenges in becoming an RN. Next point is I'd like to talk about the benefits of an RN. You will definitely make high salaries with your median starting off at about $62,450 a year, and that's according to Donald Albin, Created for Connection as well, his book.
Oh.
Another benefit is it's in high demand. You should never have any trouble finding a job as an RN. And it will only intensify, the demand will, as the shortage becomes greater, as the baby boomer generation ages, according to Ms. Muscarl in her article. Easy opportunity for advancement in the field of RN. You can advance, you can specialize in different areas of becoming an RN. You can have definitely flexible schedules with your job. So there is a lot of benefits in becoming an RN, for sure. Anywhere you would want to move, you're pretty well guaranteed a job as an RN. And then one of the last sub-points under that would be you will make a difference and have an impact on people's lives. As a nurse, your job is definitely to serve others, so you definitely need the heart for that. To meet their needs and help them recover from sickness. Gives you an opportunity to display different attributes of Christ, such as compassion, love, and kindness, which we also want to show as Christians. And Jesus says in Matthew 25 that as much as you've done this unto the least of these, my brethren, you have done this unto me. That was Matthew 25, verse 40. He also says there's no greater reward, that is, Ms. Muscarl says, that there's no greater reward than having a client to thank you for helping them feel better, especially when they're at discharge and you see that they have definitely recuperated and gotten better due to your help and your compassion for them. And last point is education requirements, becoming an RN. According to Mr. Albin, he says that typically you must either obtain a bachelor's degree, an associate's degree, or a diploma from an approved nursing program in just becoming an RN. Also, you must complete a national licensing examination in order to obtain your nursing license. And then if you choose to specialize in an area, there's going to be additional schooling, such as a nurse anesthetist, nurse midwives, nurse practitioners. You generally will have to get a master's degree, according to Mr. Allen. And in conclusion, I would like to say nursing is a rewarding field. It has both challenges and benefits, as does any job, pretty much. It can present the opportunity to fulfill many of the commandments of Christ, and it requires education beyond high school. Knowing the details regarding this field should be able to promote RNs in this field. The main problem with the shortage, I feel, is that there's lack of education regarding the benefits and challenges of this field. So nursing is rewarding, and it definitely fulfills the commandments of Christ. So the scenario I painted for you in closing, in the beginning of this speech, can easily be alleviated. It should never be that a patient who needs care while in intense pain should ever have to suffer needlessly for a lengthy time because of a shortage. This can become only a faded memory of the past when the job positions and all its benefits are exposed to all potential candidates, alleviating the problem with the nursing shortage. Thank you, and that was my speech. God bless.